Thank you, Giscon, for my introduction. So you can see that the bony defect sometimes is simple. Anyone can treat, right? But sometimes it's so difficult. You need at least 4 experts to explain to you how to treat this defect. But sometimes it's never-ending story. The key point is one, the soft tissue. You can see that all the 4 speakers talk about the soft tissue condition should be good enough. And after that, you can do the bony work. By the way, prevention of the infection is the key. So every time you face the open fracture, you have to ask someone to help you to close the open fracture very soon, especially not more than 2 days after the fracture. Second one, I think that all the 4 speakers talk about the 2 things. One is the vascularity of the fracture. If you put anything between the gap, if there's no good vascularity, all will be resolved, right? And secondly, more important than the so important as the vascularity is the stability of the fracture. You can see that all the speakers talk about how to make the fracture stable until the bony can heal. There's many techniques to deal with the bony defects. If the defect is very small, let's say that if it's less than 2 centimeters, all the speakers not mentioned about the shortening. If it's upper extremity, you can do shortening without any problem. By the way, if it's more than 2 centimeters, or if it's lower extremity, you have many techniques. First, maybe bone grafting. But if it's more than 5 centimeters, you have muscular techniques by Phiphobmongkol, or maybe dissection osteogenesis by Dr. Vajarin, or IA from Frankie. By the way, you have to know very well what is good, what is advantage of these techniques. You can see that muscular techniques has some defect about the mechanical property. You can see that if we put the muscular techniques with the lower extremity, sometimes you can face that the mechanical strength of the muscular technique is not good enough. By the way, Dr. Vajarin mentioned about the dissection osteogenesis. He believed that this is the most strongest techniques. And Frankie showed us the very interesting about the RIA that we can treat with the longest defect, maybe 20 centimeters. You can make the bony defects by these techniques. But finally, before I make a close for this session, you have to make sure that you know your skill. Your skill is the key. If you not know well about your skill, your limitation, the patient is not the experiment for you, right? You may ask someone to help you. We have an expert from other province. You can ask them about how to treat this bony defect. By the way, I think that the one that you can transfer the patient is the one that you most trust and most reliable. I think that before we close this session, we have at least 4 experts from all over the country, maybe from Hong Kong. If you can transfer the patient to Hong Kong, you can transfer to Frankie. Thank you for your session.